For patient presentation, here's an example. A 60-year-old male has been complaining of shortness of breath, swelling in his ankles, and fatigue for the last month. The etiology of congestion heart failure is due to any cardiac disorders that ruins the ability of the ventricles in the heart to fill or eject blood. The failure of cardiac output meets the demand. It does not meet the demand, meaning that the cardiac output is usually decreased due to the weakening of the heart. Congestive heart failure is the end result of a number of diseases. Here in the US, there is approximately 5.1 million patients who have congestive heart failure. About 71.8% of men who have CHF die from the disease, and about 39.1% of women who have CHF die from the disease. From these numbers, you can already tell that CHF tends to affect more men than women. There is also a high morbidity and mortality rate in older people than younger people. The main impact of CHF in patients is that they tend to live a poor quality of life, and it also tends to limit the patient's physical and social activities. This is due to patients experiencing physical and emotional symptoms such as dyspnea, chest pain, depression, or fatigue. So basically, the main impact of CHF when it comes to patients is that they tend to not do their activities like normal people. There are many risk factors when it comes to CHF, but the most important risk factors are smoking, eating foods that are high in fats, sodium, and cholesterol. Not being physically active can also be a high risk. Excessive alcohol drinking, which can lead to many diseases as well as CHF, and obesity. There are many diseases that can lead to CHF, one of them being the ending stage of coronary artery disease, which is the buildup of fatty deposits in your arteries, which tends to reduce blood flow, leading to CHF. The end stages of hypertension, this is when the afterload is increased and there is a narrowing of the arteries, which causes the heart's workload to be harder. When the heart begins to have narrowed arteries, it makes them less elastic and making it difficult for blood to travel through the heart. Alcoholic cardiomyopathy is also a disease that can lead to CHF, which affects the way the heart pumps blood. This is due to the heart muscle weakening and becoming thin. Valvular heart disease also can be a big lead to CHF because this is also when valves become narrow and they harden to open fully, or they are unable to close completely, so the heart cannot pump correctly. In this slide, you can see the normal pumping of the heart circulatory system without the presence of CHF. And that's just as a reminder, the regular circulatory system begins with the right ventricle pumping the oxygenated poor blood to the lungs through the pulmonary valve. Meanwhile, the left atrium receives oxygen-rich blood from the lungs and pumps it to the left ventricle through the mitral valve. Then the left ventricle pumps the oxygen-rich blood through the aortic valve out to the rest of the body. So this is just an example of how the heart pumps without the presence of CHF. Here you can see how the presence of CHF affects the way the heart pumps. On the left side of the image, you can see how there's a weakening of the heart muscles where the heart muscle has become very thin, not allowing the heart to squeeze as it used to. This causes less blood to pump out of the ventricles. So this on the left side it is explaining how CHF can affect the way the blood is being pumped out of the heart and how much blood is being pumped out of the heart. On the right side of the image, you can see a more thick heart muscle layer, which is also very stiff, and it does not allow the heart to relax normally. And it also has less blood to fill in the ventricles due to the thickness of the heart muscle. Just as a reminder, congestive heart failure is when fluid builds up around the heart, causing the heart to pump inefficiently. When having CHF, the muscle has reduced contractility, meaning that the heart will pump blood inefficiently. Since there is a reduction in contractility, there will also be a reduction in cardiac output. The reduction in cardiac output damages the main functions of the left ventricle. There is a decrease in muscle contractility due to the reduction of cardiac output. This is when you enter stage 1. This is when you begin to feel breathlessness or tiredness when just taking a walk or a jog. There's also a preload, which is being increased, and this is when you enter stage 2, which is when your heart begins to race or you begin to feel more breathlessness when walking or taking a jog. There's also the afterload, which is being increased, which can be caused also by a long chronic hypertension. This is when you enter stage 3. This is when you begin to feel palpitations or tiredness with simple tasks such as walking to your living room or even sitting down. And the cardiac output also affects heart rate when it is being reduced because the heart rate increases when cardiac output is being decreased. This is when you enter stage 4. This is when the heart and breath go faster even when you're resting, even when you're sitting down or laying down. Your heart begins to go faster than normal, and the patient usually begins to feel anxious all the time. In congestive heart failure, there is two types of CHF, one being diastolic and the other systolic. In diastolic heart failure disease, the heart muscle begins to become stiff and thick. Meanwhile, in the systolic, there is more stretched and thinned out chambers. On this slide, you can see the comparison of systolic heart failure and diastolic heart failure. For systolic heart failure, this is where the ventricles cannot pump enough blood volume to the body, causing for blood and other fluids to build up in some of your organs like lungs or livers. The underlying etiology of systolic heart failure will be coronary artery disease. In diastolic heart failure, the left ventricle loses its ability to relax normally since the muscle has become stiff. The heart cannot fill blood between heartbeats like normally. This is more likely to be in women who are older and have hypertension and they have no history of coronary artery disease. The cardiac output is compromised by poor ventricular compliance. In heart failure, congestive heart failure, when the left side is damaged first, this is when you tend to have pulmonary edema when there's too much fluid in the lungs. And when the right side fails first, that is when you have peripheral edema. This is when you start to show symptoms of swollen ankles. The symptoms for congestive heart failure will be fatigue, dyspnea, even when doing simple activities such as walking or jogging, cough and angina, which causes severe pain in the chest, which tends to extend to the arms and shoulders. There is also swelling in the lower extremities, which could be your ankles. Blood flow slows down, meanwhile the blood returning to the heart backs up, causing congestion in tissue, which causes the swelling in your ankles. When being diagnosed for CHF, there can be many tests that can be done on the patient. You can have an electrocardiogram, an echocardiogram, a stress test, chest radiography. For the echocardiogram, this is when the diagnostic confirms whether the heart failure is systolic or diastolic by testing the left ventricle ejection. In a stress test, you can indicate shortness of breath, chest pain when you have CHF. Stress tests show how the heart works when doing physical activities or when how the heart reacts to stress. An electrocardiogram detects abnormal heart rhythms that may cause CHF, and a chest radiography looks for venous congestions and swelling. The swelling in the chest can be the fluid surrounding the lung, which is being caused by the CHF. For treatments, there's medications that can help with CHF, such as ACE inhibitors, beta blockers, and diuretics. Beta blockers help improve blood flow by opening up your veins and arteries. It also slows down your heart rate, allowing for your blood pressure to be lower. This is usually given to the patient when they are on the third stage to help your heart pump stronger. Diuretics helps kidneys get rid of unneeded water. Due to CHF, the body tends to have more fluid than it should. With the use of diuretics, it makes it easier for the heart to pump since it is releasing unnecessary bodily fluid that is being caused by the CHF. ACE inhibitors can also be a treatment because it dilates the blood vessels to improve your blood flow. It also blocks angiotensins. These tend to narrow down blood vessels, making it harder for blood to go through. So by the use of ACE inhibitors, it blocks the angiotensins and it dilates the blood vessels to improve your blood flow. Here are my references that I used to create this slideshow. Thank you for watching.